And I just want to talk a little bit about statins specifically. So, despite extensive evidence, what are the persistent barriers you encounter to appropriate statin initiation and intensification?
So, a lot of times folks have heard negative things about statins. Maybe they had a friend who was on a statin and couldn't tolerate it. Statins are one of the most commonly prescribed medications, and a lot of folks have tried them at one point and stopped for various reasons. There's a lot of debate as to whether or not the side effects that we see from statins are, quote unquote, real or not. There's actually some trials out right now where patients are being enrolled and randomized to either a statin or a placebo to try to understand if the side effects that they're experiencing are truly side effects, or if they are actually on the placebo and saying that they're experiencing side effects. So the side effect from statins is a real concern, in the sense that folks may not take them if they feel that they're having a side effect. But there's also a lot of rhetoric and fear around taking statins that maybe is a little unfounded.
Mm.
So, aside from side effects, sometimes I will see that folks will will start taking the statin and then will stop for reasons such as cost. Sometimes, if someone's insurance changes, then they may no longer be able to afford the medication. Or, nowadays folks are deciding whether or not it's worth their money to spend on a prescription medication versus something else. And so there may be some competing priorities. And then also, polypharmacy is a big concern, especially for my older patients or patients who have a lot of comorbid diseases.
Mm. And how do you approach reported statin intolerance, and which strategies are most effective in your experience?
So, what I'll usually try, I'll look at the dose, I'll look at what type of statin they're taking. If it is a statin that is not particularly potent, then I may switch them to a more potent medication. So, maybe rosuvastatin instead of, what they had previously been taking, with the thought that perhaps we can get away with a lower dose of the more potent statin. And we'll see how that's tolerated. Switching to from one statin to another is also an idea that folks will usually try just to demonstrate if it truly is statin intolerance. And then sometimes we'll try alternative day dosing, so maybe every other day or 2, 3 times a week, just to see what if we are able to get any statin on board. And then it's a little bit of trial and error, because you have to then check the LDL levels again, check the lipid levels again, check their complete metabolic profile, make sure they're not having any signs of liver dysfunction. And so it does take some time to finally get to a dose that is tolerable. And then you have to determine if the effect is strong enough, or if maybe you need to add an adjunct therapy.